today we have kept only the single based answer question answer session, and individual topic will take serially in this particular upcoming week. Okay, so, so one by one you can start answering. So first, Dr. Amrita, you take the
Yes, sir.
question, the slide
Yes, sir.
one. Yeah,
Which of the following factors is most likely to impair wound healing? Option A, good nutritional status. Option B, early mobilization. Option C, vitamin C deficiency. Option D, normal blood glucose levels. Option E, adequate oxygenation. So the answer is option C.
correct. Okay.
Yes,
Question
sir.
two.
Which type of necrosis is most commonly associated with ischemic injury in solid organs, such as the heart? Option A, coagulative necrosis. Option B, liquefactive necrosis. Option C, caseous necrosis. Option D, fat necrosis. Option E, fibrinoid necrosis. Sir, option A, coagulative necrosis.
Coagulative necrosis.
Yes, sir.
Okay. So, question one, it is vitamin C deficiency will impair the wound healing, and coagulative necrosis is a characteristic of ischemic injury in most of the solid organs. Okay. So, actually, except it is in the brain. Okay. So, next question three and question four, Dr. Sinchana, you'll take this.
Yes, sir. Which of the following best describes a key feature distinguishing benign from malignant tumors? Presence of capsule, increased mitotic figures, local tissue invasion, cellular atypia, vascular supply. Sir, actually, it can be cellular atypia as well as uh,
Cellular TPI as well as.
increased mitotic figures also.
Okay. Among
Option
these two,
A. Option A.
among
Option
B and
C.
D,
Hmm.
Doctor, and what about option C?
Yes, option
Yes,
C.
sir. It also represents malignancy, more towards malignancy.
Sir, yes,
Only
sir.
A, only option
Yes.
A is towards
Benign.
benign.
Yes.
Rest all is towards malignancy.
Malignancy. Yes.
C. Among these now B, C, D, what do you feel is the most important?
So cellular atypia is
ATPia.
associated with malignancy.
ATPia, sir.
And what about invasion? Can you have a TPI without invasion?
Mm.
Uh, mm, no, sir.
Suppose there is a endometrial hyperplasia, suppose there is a endometrial hyperplasia without urticaria. So is there a attribute that there should be invasion? So what do you think? Cellular urticaria always goes with the malignancy. So what is going to be the, there is a difference between the normal, abnormal, and malignancy. So there is something which is called as pre-malignant condition. In that particular condition, you are going to get certain changes. So you should be able to differentiate that from the malignancy. So what do you think among these options which will go towards the malignancy more? Okay. Okay. Go ahead with the next question. Okay, invasion into the surrounding tissue is a hallmark of malignancy, unlike benign tumors, which are usually well circumscribed. Okay, then next one, fourth answer is a vascular endothelial growth factor. VEGF plays a central role in promoting new blood vessel formation during wound healing. Okay, next,
Yes.
Dr. Amrita.
Yes, sir. Which of the following is an example of tumor suppressor gene? Option A, RAS. Option B, MYC. Option C, TP53. Option D, HER2. Option E, BCL2. Sir, option A, RAS.
No, no. C, TP53.
C
TP53.
option.
C
Option
Yes,
C.
yes.
option.
Sorry, sir.
Who else had joined? Dr. Priyanka had joined? Only two. Sansi has also not joined?
Sansi has joined, sir.
Okay, okay.
Yes,
So,
sir.
Dr. Amrita is answering now.
Yes,
So,
sir.
finish with the sixth, then Dr. Sansi will take seventh and eighth. Okay.
Yes, sir.
So, next
Question,
question.
question number 6. Which organ typically exhibits liquefactive necrosis following ischemic injury? Sir, option D, brain.
Option.
D, brain.
Okay. So, TP53 is the answer for question number 5. So, TP53 encodes the P53 protein, which regulates the cell cycle arrest and apoptosis. It's a classic tumor suppressor gene. Okay. And question 6, the option is D, brain is the answer. And ischemia in the brain leads to liquefactive necrosis due to the enzyme digestion of the neural tissue. Now we'll go with the question number 7 and 8. Dr. Sansi, take these two questions.
Which phase of wound healing is characterized by fibroblast proliferation and collagen deposition? A. Hemostasis. B. Inflammatory phase. C. Proliferative phase. D. Maturation phase. E. Resolution phase. Sir, option C. Proliferative phase.
So fibroblast proliferation and collagen deposition of proliferative phase. Wound
Hmm.
healing and these are called as general pathology topics. So two, three topics are important from this, like neoplasia is there, inflammation, wound healing, apoptosis. These particular things you should remember. Go ahead with the next question.
Which
This is
of the
from
following
neoplasia.
best describes anaplasia in malignant tumors? Reduced mitotic activity, well differentiated cells, uniform cell morphology, lack of differentiation, encapsulation of tumor mass. Sir, option D, lack of differentiation.
Correct. So anaplasia in the malignant tumor will be denoted by lack of differentiation. So question number 7, it is a proliferative phase. The proliferative phase involves fibroblast, collagen deposition, angiogenesis, and reepithelialization. Okay. And question number 8 is a lack of differentiation. Anaplasia refers to the loss of structural and functional differentiation in the malignant cells. Dr. Sinchana, next two questions.
Yes, sir. Which of the following is the primary mediator responsible for vasodilation in acute inflammation? A. Bradykinin, B. Histamine, C. Interleukin 1, D. C. Reactive protein, or E. Leukotriene B4. B. Histamine.
Acute inflammation. Okay. Okay. Go ahead with the
Which
next question.
leukocyte is the first to arrive at the site of acute inflammation? Eosinophil, lymphocyte, basophil, neutrophil, monocytes. Neutrophils, D neutrophils.
Correct. So the answer for the question 9 is B option, that is histamine. Histamine causes vasodilatation and increased vascular permeability in the early acute inflammation. Question 10, the answer is D, neutrophils. Neutrophils are the first responders in the acute inflammation, arriving within the minutes to hours. So these particular topics, please go through it. Actually, I have posted all the study material in the group regarding the wound healing, also inflammation, also. Okay, so please go through all that material. Next, Dr. Amrita, question
Yes, sir.
11 and 12.
Which question 11, which morphological feature is most characteristic of apoptosis? Option A, inflammatory infiltrate. Option B, cellular swelling. Option C, nuclear fragmentation. Option D, cell membrane rupture. Option E, enzymatic digestion of tissue. Sir, option E, enzymatic digestion of tissue.
No,
Apoptosis.
apoptosis.
Apoptosis, sir, it is when
Cell, cellular
That is,
swelling.
that is the physiological death of the tissue. Okay,
physiological death
organ.
of the tissue.
Yeah.
Yes.
So what happens there?
Nuclear
Among
fra-
yes. Go ahead
nuclear
with the next. Yeah.
yes.
Go ahead with the next question.
Question 12. Which of the following hypersensitivity reaction is antibody mediated and involves complement activation? Option
This
A type
actually we have covered with the immunology also, but it's repeated because there are certain overlapping topics.
yes.
Yes,
Option A type 1, option B type 2, option C type 3, option D type 4, option E type 5. Sir, option C. Type
Type 3.
type 3, yes. Type 3.
Antibody mediated and complement activation.
Type 2.
Type 2.
Type 2, 2.
2.
Mm, I will go through it again regarding question number 12. Okay. Question number 11 is nuclear fragmentation. Apoptotic cells show nuclear fragmentation, chromatic condensation, and shrinkage without inflammation. Okay. Question number 12 is a type 2. Type 2 hypersensitivity involves IgG, IgM antibodies binding to antigen on cells, leading to complement activation. So we'll review again hypersensitivity reactions once. Okay. Next question 13. Dr. Sansi, 13 and 14.
Which of the following laboratory findings is most consistent with iron deficiency anemia? Elevated serum ferritin, increased MCV, low serum iron and low ferritin, elevated transferrin saturation, increased retic count. Sir, C, low serum iron and low ferritin.
Correct. So iron deficiency anemia and anemia from hematology section of the pathology. Not only that, it can be asked in the data interpretation also. They might give you a clinical scenario and various blood investigations, and you have to interpret and come to a diagnosis. There is a separate data interpretation module. Okay, in which that mainly depends. Module is on investigations basically. You may be given NST and you will be asked about the interpretation. Then it might involve acid base balance. All those topics will be covered under this data interpretation. Okay, so next
Hmm.
question, Dr. Sansi.
22-year-old woman presents with fatigue and pallor. Her blood film shows microcytic hypochromic red cells. What is the most likely cause of her anemia? Vitamin B12 deficiency, aplastic anemia, iron deficiency anemia, sickle cell anemia, anemia of chronic disease. Sir, iron deficiency anemia.
Yes, it is a straightforward question. Microcytic hypochromic anemia. So it's a iron deficiency. So question number 13 is a low serum iron and low ferritin seen in iron deficiency. And question 14, that is a typical picture of iron deficiency. Dr. Sinchana, next two questions.
Yes, sir. A patient has normocytic normochromic anemia with low reticulocyte count. Which of the following is most likely diagnosis? Iron deficiency anemia, anemia of chronic disease, thalassemia, hereditary spherocytosis, or vitamin B12 deficiency?
See,
It
normocytic
is
normochromic anemia and low retic count.
anemia of chronic disease because there'll
Yeah.
be
Yes.
no
Yes.
production.
Yeah, and it's a normocytic normochromic, but still there is an anemia. Rest of the things will have some other associated things. Okay,
Yes, sir.
like iron deficiency will not have normocytic normochromic.
Microcytic.
Vitamin B12 will also not will have, and hereditary spherocytosis they will give a typical picture. Okay, so next question.
Which of the following laboratory findings is most characteristic of hemolytic anemia? A low reticulocyte count, low lactate dehydrogenase, high haptoglobin, elevated unconjugated bilirubin, and hypersegmented neutrophil. Elevated unconjugated bilirubin is the answer.
Correct. So question number 15 is anemia of chronic diseases, and question 16 is elevated unconjugated bilirubin that is seen in hemolytic type of anemia. Next two questions, Dr. Amrita.
Yes, sir. Question number 17. In thalassemia trait, which of the following is typically found on peripheral blood smear? Option A, macrocytosis. Option B, Howell Jolly bodies. Option C, microcytosis with target cells. Option D, hypersegmented neutrophils. Option E, cystocytes. Uh, so option C, microcyto. Option B. Option B.
Option
Which is your
C,
answer?
Option C
microcytosis.
with target cells.
Target cells.
Microcytosis with target cells. So,
Option C. Okay,
yes.
next question.
Question number 18. A patient with macrocytic anemia has elevated homocysteine and methylmalonic acid levels. What is the most likely diagnosis? Option A, folic deficiency. Option B, vitamin B12 deficiency. Option C, iron deficiency anemia. Option D, sideroblastic anemia. Option E, lead poisoning. Sir, option A, folate deficiency.
You have homocysteine methylmalonic acid
B12.
level. Yeah, option B is the correct answer. So
B12 is
microcytosis, question number 17, microcytosis with target cells. Also in thalassemia trait, it is a microcytosis with target cells. Option C is the correct answer. And question number 18, you have elevated homocysteine methylmalonic acid levels. They are increased
Vitamin
with
B12.
vitamin B12 deficiency. Okay.
Yes, yes.
Next, Dr. Sansi.
Which of the following would most likely to be seen in aplastic anemia? Elevated retic count, bone marrow hyperplasia, pancytopenia, microcytic anemia, high serum iron ferritin. So pancytopenia.
Correct, correct. It's a
Yes.
straightforward question. Aplastic anemia, you are going to have a pancytopenia. Next question.
What is the most appropriate initial investigation in patients suspected of having iron deficiency anemia? Bone marrow biopsy, serum vitamin B12, serum ferritin, hemoglobin electrophoresis, DCT. Sir, serum ferritin.
Correct. Okay. So
Serophilic.
it is an initial investigation. Among these, that is the only initial investigation that will come for iron deficiency anemia. Okay. So the answer is a pancytopenia for question 19 in aplastic anemia, and initial investigation in iron deficiency is a serum ferritin. You should know the values also. Okay. Next question, Dr. Sinchana. This is the last question. We'll stop after this question.
Yes, sir. 10-year-old boy from a malaria endemic region presents with anemia and splenomegaly. His blood smears reveal sickle cells. What is most likely diagnosis? Thalassemia major, sickle cell anemia, iron deficiency anemia, aplastic anemia, G6PD deficiency. It will be sickle cell anemia.
Correct. So it is a sickle cell anemia. Okay. So now next week we will have a specific session. In short, we will cover general pathology, but mainly the oncology, various like ovarian tumor, always ask CS cervix, endometrial carcinoma, and all those things. So we will cover the pathology related to it in subsequent sessions. So may we start here. Thank you very much.
Thank
Thank
you,
you.
Thank you,
sir.
sir.